So, with that being said, I'd love to know if a patient is newly diagnosed with breast cancer, how do they make the decision on whether or not to remove possibly the opposite breast?
Well, first of all, you have to look at your imaging studies. For instance, if your medical oncologist or your breast surgeon has ordered additional diagnostic imaging or an MRI, you want to make sure that breast is clear. We are supposed to tell you as breast surgeons, they call it a contralateral mastectomy, meaning removing the breast that doesn't have breast cancer. If it's a normal breast, we honestly cannot tell you to remove a normal breast because there's no cancer in it. And when we look at the risk for developing a breast cancer down the line, especially with good treatment, it's actually not that high. However, I don't talk patients into or out of removing a normal breast. What I tell a patient is it's going to be a personal choice. I will say that if it gives them peace of mind and symmetry, especially if you're getting a mastectomy with reconstruction, or even if you're getting a mastectomy and you want to be flat, it's so that you can be symmetrical on both sides. Another benefit to removing the breast is you don't have to really get imaging studies anymore. You don't have to get that annual mammogram. What I always tell patients is that removing both breasts does not make your risk for breast cancer 0%.